This is going to be topic 12, public health.
So after completion of this chapter, you'll be able to understand these concepts. Improvement of a community's health status, the broad mission of public health, the international issues relating to public health, EMS as a safety net in public health, and EMS roles in healthcare access and disaster management. What is public health? The World Health Organization's definition is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. It extends also to large groups, communities, and nations, the practice and discipline of improving the health of communities, and it's focused primarily on prevention of illness and injury. Public health agencies respond to disease outbreaks and disasters and work closely with the paramedics to prevent such occurrences from reaching catastrophic proportions. Community-based disease prevention, public health in history. Quarantines have been traced back to biblical times. The Romans prevented the spread of disease by development of sewage systems. 14th century Europe used quarantines during the bubonic plague. Despite attempts, disease still spread, primarily due to misunderstanding of the disease origins. Now, Koch came up with 4 postulates, and he was a scientist, and these 4 postulates has kind of helped us define diseases. Established that the organism is the cause of a particular disease, and permitted public officials to incorporate quarantine while allowing physicians and scientists to identify, isolate, and inoculate the population against the disease. And these are Koch's postulates, and this is figure 7.2 in your book. The organism must be found in all animals suffering from a disease, but not in healthy animals. The organism must be isolated from a diseased animal and grown in pure culture. The cultured organism should cause disease when introduced into a healthy animal. And the organism must be re-isolated from the experimentally infected animal. So all of those helps identify the disease that we're trying to fight. Missions. Traditional public health missions were isolated on these areas right here, which are women and children, substance abuse, workplace safety, and environmental safety. The public health team is multidisciplinary, which it involves biologists, sociologists, social anthropologists, engineers, politicians, health educators, industrial hygienists, health reporter, sanitarians, environmental health specialists, physicians, nurses, and paramedics. Public health organizations. They include epidemiology and biostatistics, environmental health, social and behavioral health, occupational health, and disaster planning and response. And we're going to talk about each one of those just a little. Epidemiology and biostatistics. They accomplish their mission to monitor, identify, and prevent outbreaks of disease. Defined as a branch of the medical sciences that deals with incidence, distribution, and the control of disease in populations. An epidemiologist monitors disease outbreaks and how they are spread. Biostatistics is an application of statistical analysis to biological data, mathematical component of epidemiology. Environmental health. Physical, chemical, biological, and psychosocial well-being of a person as it's related to the natural environment is what environmental health is. The most common subject is pollution. Pollution control has been in practice for about 50 years. Human and consumer waste sanitation, preventing waste and pollution of the soil and water, and industrial and toxic waste disposal. And this enforces strict standards to contain it and prevent it from contaminating soil, water, and air sources. Social and behavioral health. Important to overall population and well-being. Overpopulation and overcrowding is also subjects in this. Increases the risk of a disease, raises sanitation and safety concerns, and an example of this would be in the prison systems. Occupational health. In the past, workplace injury was kind of commonplace. Productivity suffered, taxpayer was burdened for the support. Occupational health is responsible for helping to maintain safety within the workplace, decrease workers' injuries, and reduce health-related expenses. In 1995, the International Labor Organization and the WHO, or the World Health Organization, established the goals for occupational health. And their goals were simple: decrease worker injury, improve worker morale. Common workplace hazards were identified. Disaster planning and response. Natural disasters have garnered international attention and emergency services responses. Quick and coordinated response is crucial. Pre-planning can mitigate resultant harm. Pandemics or outbreaks of disease that spread through a country or a region may reach disaster proportions if not prevented and controlled. And examples of these would be H1N1 and SARS. Large-scale accidents and mass casualties pose a threat of exposure to chemical and environmental toxins. An example of this would have been the World Trade Center and the attack of September 11th. Public health officials and researchers are involved in planning escape routes, resource mobilization, response policies for such disasters, and working with EMS providers to be prepared. Goals of the occupational health was developed by the Joint Committee of the World Health Organization and the International Labor Organization in 1950, and these is what they come up with. This is table 7.3 in your book. The promotion and maintenance of the highest degree of physical, mental, and social well-being of workers and all its occupants. The prevention amongst workers of departures from health caused by their working conditions. The protection of workers in their employment from risk resulting from factors adverse to health. The placing and maintenance of the worker in the occupational environment, adapting to his physiological and psychological capabilities, and the adaptation of work to man and of each man to his job. Public health management. Organizations work together. No worldwide typical structure. Internationally, we have the World Health Organization, which kind of takes a big standpoint on this, and the most prominent and influential of the international public health agencies. This was founded in April of 1948. Specialized health agency under the United Nations. And the primary constitutional objective attained by all peoples of the highest possible level of health. Attainment by all peoples of the highest possible level of health. It is governed by a 193 member nation, managed by the World Health Assembly, and focuses efforts on monitoring disease outbreaks and assisting individual governments with the development and administration of vaccines. Next organization we're going to talk about here is the World Federation of Public Health Associations. International non-governmental organizations. This was established in 1967. The purpose was to bring together multiple international public health workers for professional exchange, collaboration, and action. Currently 70-member organization that meets annually to discuss partnerships and collaborate efforts in public health, research, and policy. They share information and publications, and they assist each other in the implementation of these policies. American public health movement. Early 1800s. American cities were ravaged by epidemics of smallpox, yellow fever, and cholera. Quarantines and in-house confinement were the only effective means of preventing spread of disease. Industry suffered from massive sick calls, leading to declines in productivity. Wealthy patrons hired graduate nurses to care for the poor, reduced disease incidence, and improved public health. Taught the public basic sanitation practices. Infant mortality was also a problem, particularly in the inner city, and early public health efforts were meant to improve maternal child health. Federal Public Health Service. Early origins of public health. This was preceded, or the person that was in line before this was the Marine Hospital Service. If a sailor paid 20 cents a month, they were provided with medical care. The Marine Hospital Service and the Public Health Service later became a key portion of the Department of Health and Human Services. The United States Public Health Service contains 5,700 commissioned health service officers and 51,000 civilian employees. This is led by the Surgeon General and comprised of 8 agencies. Center for Disease Control. and Prevention, or the CDC, leading the U.S. governmental agency for public health study, recognized independently worldwide for significant contributions to public health and safety, focuses research and policy efforts on emerging infectious diseases, chronic medical conditions, and environmental health and safety. Various publications used to communicate this. American Public Health Association, or the APHA, works to promote the health of American citizens through preventive efforts, research, and public health practice and policy. And the Occupational Safety and Health Administration, or OSHA, federal government's effort to promote occupational health. This was founded in 1971 to reduce and prevent work-related injuries, illness, and death, responsible for developing and enforcing various standards of safety in the workplace. Permissible exposure levels to chemical and dusts, personal protective equipment, confined space condition, bloodborne pathogen exposure guidelines, and prevention strategies to prevent pandemic influenza outbreaks. State and local governments. The primary source of public health policy and regulation in the states, in each state, involved in the enforcement of regulations, and they are responsible for developing and enacting the majority of public health laws in accordance with accepted international and national standards. EMS personnel will have the most contact with these local public health agencies. An example of this would be the Oklahoma State Department of Health. Public Health and EMS. December 2001, in the Annals of Emergency Medicine, this outlined the joint efforts of public health and emergency medicine. EMS is considered crucial to the developing or in the delivering of the highest quality of care in public health surveillance and response. Paramedics are primarily a community-based health organization in a position to assist public health officials with identification of infectious diseases and mass immunizations. Healthcare access. Concerned with the access of healthcare to an individual and to the population. And we start seeing this is where we deal with things the most here, which is in the emergency department. And the emergency department serves as a site of preventative care for those without a primary care physician. And this is not ideal in any means. Operates in its primary function as a treatment center for acute medical and surgical conditions, and that's the emergency department. And the roles of the EMS provider are to assist in the transport of these patients to the emergency department in times of medical need, and this is a crucial link. Without this, healthcare to the masses may fall completely apart. We are essential in this. Disaster response. Disaster response is a partnership between EMS providers and public health officials. And the goal here is to prepare for and respond to pandemics, natural disasters, and mass casualties. Vital to reducing morbidity and mortality, joint preparation sessions allow for the individuals to meet and become familiar with their roles. Conclusion. Public health focuses on prevention. Public health agencies work closely with EMS to provide a response to disaster and disease. EMS providers must understand the organization and workings of public health at all levels. It facilitates cooperation and participation in prevention and the responses to operations. So we have a big role in public health. References for this lecture.
And if you have any questions concerning this topic, feel free to contact me. My name is Roy Smith. SmithArt, SamaritanEMSOK.com or 45492-8243. Thank you.